Okay, so before I get calls from everyone to say, go on, start talking, let me start talking. Welcome, everybody, and good morning, good afternoon, good evening, depending on where you are. I hope that everybody's sound is working and vision is working. I see we have our 59 participants out of, I think, about 100 registered. Anyway, welcome to this webinar on measuring the transformative impact of participatory visual methods. I'm sure you're all clear about the terminology I'm using here, but might be worth mentioning that we're interested in the range of participatory visual methods: cell films, photo voice, participatory video, drawing, mapping, digital storytelling. And occasionally I come across somebody who doesn't know what cell films are, and this is using a cell phone to capture images, following a narrative or storyboard. And what's interesting for us about that is not so much the technology of making the film, but in its participatory modality, how the group builds up the narrative and the storyboard and decides who it's going to target and so forth. So, participatory visual methods. Getting down to business. So this is a direct quote from a cell film participant, and it evokes a very strong sense of impact from somebody who lived the experience. And this kind of report is not uncommon. It's really heartening. When I heard this particular one, like everybody else, I said, yeah, great, it worked. But then immediately there are a whole series of questions, like why did it work? What changed? And most of all, how do we get that change happening for others? And those are the questions that we're going to try and deal with in this questionnaire. So many of you are familiar with my theory of transformative participatory research, particularly how we try to leverage specific dynamics in the research that engage executive function, executive function. That's inhibition, control, recent memory, and innovation. So some of you are also partners in our pilot randomized control trial, looking at how those dynamics in transformative participatory research might help to prevent dementia. So even if we do a shallow dive into the neurobiology of participatory visual methods, we learn a lot about the value that these methods add. First of all, the participatory aspect doubles down on the dynamics of participatory research by engaging executive function as well. But there are other quite specific and really interesting neurological pathways that come into it. The visual narrative goes through the occipital lobe and the hippocampus and the amygdala to encode emotional memories. And so participatory visual methods reframe or can reframe traumatic or significant experiences by integrating them with new perspectives. And that transformation is really high value because it means that potentially traumatic episodic memory gets reframed by doing the participatory visual method as prospective memory, which is for planning future actions, or even as semantic memory, which is the evidence synthesis as different memories are tied together with others. So this is huge for creating a psychological distance from what might be disturbing content or disturbing memories and turning into something constructive and something shared. So the third value that these methods adds is through the mirror neuron system, when the collaborative visual network fosters a shared understanding, and this reinforces social synchrony. It's a really important part of the mission in participatory research. And it also promotes neuroplasticity, which goes through neural pathways that are linked to problem solving and self-efficacy, really high value things. And then there is the dopamine release. Anyone who's actually done participatory visual methods knows about that feeling of well-being, of interest, excitement, that is very much part of the picture. So taken together, participatory visual methods is a very good deal in terms of the neurobiology. So coming back to this I'm a changed person report, compelling as that is, and as much as it makes us feel that, okay, we've done what we came for, there's surprisingly little literature on the impact of participatory visual methods. There's massive literature on participatory visual methods, but when I looked for what had been published just in 2024, I stopped counting when I came to 500 articles and books. But I found only a tiny handful actually measuring its impact. So Yasmin Elmi did a search of sub-Saharan Africa, work with youth in sub-Saharan Africa, and found 800 records, of which only 9, it looks like 1%, had reported impact, and only 1 actually had a control group to be able to measure it in any serious way. So we've got this thing where we know there's an impact, and we just don't have information on it, which I guess is why we're doing this seminar, to try and open this up a little bit and share what we've done, and to invite many more. Of course, one can do a lot with the impressions and with the narratives of researchers and participants, and we found them a very good way to understand and to document impact as we go along. Particularly one technique, most significant change, gives us a way to unpack how participants have lived the experience in its simplest form. It's somebody says, I'm a changed person, and we say, can you tell us the story about what changed? So it's not a complicated method, although it's harder to do properly than one would imagine. The main thing is that it describes the positive picture in very compelling terms, but it leaves a bit of a blank about the second or third most important change, or where there's no change. So the other big problem is that it's been mostly done with adults up to now. So we've had to do several resets in using the technique with youth, and Umaira will be telling you a little bit about that. So this introduces the next building block in measuring the impact of participatory visual methods, which is clarifying what change we should be expecting according to those who live the change. It's very easy to do it, to imagine what it would be and say, well, we're going to measure what we imagine. But there are participatory methods, and Iván will be telling you about one of them, that we use for deciding what it is we're going to measure and how we're going to measure it. So he'll be describing our work with fuzzy cognitive mapping, which is itself a participatory visual method. We also have experience with theory-informed outcomes, and I just mentioned that very quickly. The particular theory of behavior change that we favor is a fairly intricate one, which we call Cascada, on the acronym of moving the intermediate outcomes between knowledge to attitudes to subjective norm to change intention, agency, discussion through to the action. This particular data set comes from around 6,000 people in a participatory research project to control dengue in Mexico. So 45 communities were in a control group and 45 communities in intervention group. And there was a very big difference. You can see in the control group, there was the flow or the influence of knowledge was blocked on its way to action. And the intervention group didn't have those blocks. So this particular project didn't use participatory visual methods, but we can use that same approach for analyzing what works and what doesn't work, and how far participatory visual methods do work. So mentioning the Cascada analysis brings up the issue of how many participated and how many benefited. So we're all very happy with the small achievements, and small is beautiful, but it really is much more beautiful if many more can benefit. That's not to say the individual impact is trivial. It's just that we want to know how we can do that for hundreds, if not thousands of people. And I want to spend a minute or two telling you why I think this is important. Well, a few reasons, really. So starting with one, this is a project in Botswana on dementia prevention. So dementia is a massive problem worldwide, and every year it's a bigger proportion of those who are suffering who live in poorer countries, the low and middle income countries. The main preventable investment in dementia prevention right now is in drugs. And the best of those available cost around $50,000 a year per person. And the evidence that they work is actually quite dodgy. So these are out of the reach of everyone, and especially out of the reach of people who live in poorer countries. So what we need is an approach that doesn't cost very much, that can be done everywhere, and that works. So we are working on this idea that if older people, older adults at risk of dementia do participatory research and use participatory visual media, they will stimulate and use the executive function that is lost in Alzheimer's disease. So, and this is the bottom line about scale. We need to show scale to show its relevance to everybody, because we need to be able to prove very literally in a way that stands up at national budget meetings that participatory research and participatory visual methods are transformative and they change the game. So my second and third and fourth reasons are recently funded projects we have to reduce gender violence, youth suicide, increase youth access to services, and in cultural safety and continuity. And all of these, we're very keen it works at the individual level, but we're also very interested that it works at scale. So that's why the content of this presentation ends up being a bit of a departure from the excellent work that's gone up to now on participatory visual media methods. So beyond the impact on participants, we're also interested in the impact for people who are not participants. What happens to their family? What happens to their friends? What happens in their communities? Is there something that the participatory visual methods key off in the community that lasts longer than our research? In all participatory research, sustainability is a pivotal concern. What happens when we go? And Anne will be sharing quite a bit of our experience measuring this delayed effect. And what about ripple effects? These are the side effects on things like stigma or the bigger issues of disadvantaged people being heard or not being heard. And can we get more for this effort that we're doing? So it's not a feature in this webinar, but our work in Botswana has had an interesting side effect on intergenerationality as younger people come forward to help the older people in the participatory visual methods, and all the consequences that has for social cohesion, as well as for the number of people who benefit. So one of the concerns that I have here, and it's very seldom taken into account, is what happens to those who don't participate? Are we, in doing participatory visual methods, making a more exclusive club, those who have voice, having a better voice? How can we make the process pro-equity, or at least not increase inequity? So this is something that we're constantly aware of when we're working in communities, particularly as we're pushing for the scale issue. So we started to answer these questions by starting to work in multiple groups. So it's not just getting a voice at the table, but multiple tables, and recognizing that not everyone's going to fit around the same table, but there can be many tables. So we're starting to work in those ways. We were featuring it very much in this webinar, but I didn't want it left off the agenda. So the early question in measuring any change is this a chance finding? Did that participant who said, this changed my life, was that the only one that it happened for? So it's an issue of the numbers. Where lots of people show the change, it's less likely to be a change, to be a chance finding. And do we know that it was actually doing the participatory visual methods that made a difference? So we very unashamedly use an epidemiological backbone to all of our work. The contrasts or the counterfactual comparisons help us to answer these questions, and Anne will be taking you through some of the steps and some of the results in that work with young people making and screening cell films. So the actual tools we use really matter, quite what questionnaires. These are not off-the-shelf questionnaires, and Iván will describe what we do to make our questionnaires, to base our questionnaires on the way participants see outcomes and what's important for them. We do use standard measures as well, where these are available, but always contextualized by what the participants want to see. So we also have, and this is the last part of the slide in this series, under what conditions the work, it works for people and under what conditions it doesn't. So it's very easy to unpack this if we have big numbers. It's almost impossible to unpack it if we're working in small groups. But if we do have big numbers, we can use sensitivity analysis to look what happens when we exclude older male youth, what happens when we exclude younger youth, and so on. So when it did not make a difference, or difference is not just a yes, no, my life changed, my life didn't change. I've mentioned the Cascada approaches that look at degrees of change and the obstacles of change, and we have to get a lot better at that. So my next task is to walk you through the 4 current projects that the examples will be coming from. The first is a 5-year project in northern Nigeria on youth sexual and reproductive health, and it's in 60 communities. We tend to work in this sort of middle range of size. There's another 2 years to run. This followed the standard process of design consultations, going on to focus groups, going on to fuzzy cognitive mapping to collate the different views of the different groups. And then these results guide a baseline survey, which goes on to making and sharing cell films and docudramas. And then based on the docudramas, the youths made cell films about their concerns, and they shared this and the docudramas with community leaders and parents. And then the dialogue groups saw this information and discussed their options for how to go forward. So Umaira will be sharing with you how we use the narratives of change in this particular project to understand what the cell films and dialogues meant as an impact on the adolescents and others in the community, and will describe the quantitative measurement of these changes. The second project is about community responses to COVID. After the initial design consultations, we did fuzzy cognitive mapping again to clarify that who thought what made things worse and what things were made worse by the pandemic in different segments of the community. And this helped to set the questionnaire for the baseline survey, which was about 1,200 households in 9 communities. We also measured other things like social capital and community resilience, and then worked with community groups to create documentaries, docudramas, based on the fuzzy cognitive mapping and survey findings, and shared these with communities in dialogue groups. So Iván will be talking about the use of fuzzy cognitive mapping in this project and how that informed the questionnaire. The third project, which I've referred to a couple of times already, is this pilot study in 2 rural communities of Botswana and in Montreal, which recruits older adults at risk of dementia. The baseline includes cognitive testing. Then the groups of older adults work in the intervention groups to examine their shared concern. They then go on to make videos or whatever they decide to do. We have a lot of good experience from Botswana now about older adults making cell films. A surprising impact of this that I mentioned before was the intergenerational effect that sort of sprung up really unexpected, but it turns out that these unexpected alliances can come up in the course of participatory visual methods. And the fourth case actually is a bit closer to McGill's home. It measures the impact of participatory visual methods. In a project where we're working with Iván Kwan at the Teenage Health Unit in the Herzl Clinic, where we use these methods with teenage students to see what would make it easier for them to use the services offered by the unit. So we conducted fuzzy cognitive mapping as usual, again with the students, the school counselors, and with the staff. And this is now begun to go through a series of dialogues. The first dialogue was earlier this week, providing the decision makers at the unit the options to consider in their service review. Iván will mention how we measured the impact of the fuzzy cognitive mapping itself, because that's also a visual method, a participatory visual method, on the teenage participants. I'll click out of that as to allow Umaira to, I'll stop sharing that as Umaira joins in, to explain a couple of things. So first, Umaira is going to be talking about most significant change. Then Iván will talk about fuzzy cognitive mapping in the design of questionnaires. It's got many other uses. There comes Umaira's screen, great. If you have any questions of the presenter, could you please put them in the question and answer? We'll try and deal with the clarifications after the presentation, but if it's a discussion point, please hold it until after the commentaries at the end of the four main presentations. If you do have a question of clarification for one of the presenters, Andres will convey that to the presenter, and they'll clarify at the end of their presentation. So thanks once again, and over to you, Umaira.
Thank you, Professor, and good day. Hello to everyone. I am unable to switch on my video because I'm experiencing some very weak connection, so please bear with me. Sorry about that. So thank you, and I'm grateful for the opportunity to present today among giants. My presentation focuses on assessing qualitative transformative impact of participatory visual methods using the most significant change technique. Essentially, the MSc technique involves the collection of significant change stories coming from the field. The central part of the MSc process traditionally involves asking the storyteller, "Tell me a story," with a focus on capturing the most significant change as a result of their participation. While this simple technique works in certain settings, our work with adolescents in Bauchi required using a modified method to capture stories of change from young people. It helps to have an experienced team on board. Training and piloting, likewise, are equally useful. We also found that it is important to bond with young storytellers. One field team member, for example, would take a short walk with storytellers and discuss topics like football before asking them to recount a story of significant change. Doing this helped establish a relationship and helped adolescents to share some very personal stories. A story of change is incomplete if it does not capture the significant change in people's lives. We encouraged young storytellers to reflect on the events in their lives before the change. Doing this, we were able to record moving details of past struggles and challenges. We asked storytellers some general questions about their lives, which not only helped weave a great story, but it actually also helped young adults relax and become involved in the exercise. Questions like, what do you dream about? And what is your favorite childhood memory, for instance? Provided heart-touching insights in their lives and made the stories real and moving. 4 groups of adolescents segregated by age and sex participated in self-film production in 30 intervention communities. We collected their stories. Adolescents shared their self-films with traditional and religious leaders, service providers, and parents in community screenings. We collected stories from these adults as well. Most storytellers, both adolescents and adults, were members of dialogue groups. In total, we collected 51 stories from adolescents and 29 stories of change from adults. Team members interviewed storytellers using a semi-structured interview guide. They took detailed notes by hand and read their notes back to the storytellers once they had finished. We are still in the process of analyzing the stories of change. However, some strong themes are emerging from the stories of adolescents. We are seeing a multiplication effect in adolescents who are now agents of change in their communities. Young storytellers also feel more valued, more confident, and desirous of change. Many adolescents have become agents of change in their communities. They started advocacy groups in their schools, among their friends, even within their families. As members of dialogue groups, many have become active on issues related to adolescent sexual and reproductive health. Gaining recognition and respect in their communities was an important theme among many older boys, as characterized by these examples. Many girls reported that participating in the self-film production had given them confidence and helped them come out of their shells. They feel less shy and are able to effectively communicate with their friends and family. Making self-films helped adolescents reflect on their lives. Some adolescents decided to change after they played the role of a reformed character on screen. Creating self-films also gave adolescents a chance to speak out their minds openly without fear of rebuttal. Many adolescents noted that other people watching self-films changed things in their families. We collected stories of change from adults who had watched the self-films. Most of these adult storytellers were also members of the community dialogue groups. Stories shared by adults focused on strong themes of community empowerment, challenging norms and traditions, changing attitudes, and initiating action at community level. Most storytellers reported that things changed in their community after self-film screenings. Male and female leaders feel that their community is empowered to take action at a broad level. Self-films also encouraged adults to look at things differently. Many of them addressed suppressive traditions and made a conscious effort to change things in their families. Lastly, many adults, including the community leadership, started taking adolescents seriously. This is an example characterizing this kind of change. Thank you so much. And with this, I come to the end of my presentation.
Thank you, Umaira. Excellent. If you can stop sharing, good. And then Iván will be next discussing participant input into design of questionnaires. There we go.
So, hello everyone. Thanks for joining us today, and thank you for this kind invitation to share our experiences with the use of fuzzy cognitive mapping as a tool to facilitate the measurement of changes related to participatory visual methods. And I'm very grateful with the many team members that have carried the work that I'm presenting today, and I'm honored to be speaking on behalf of all of you. So thank you very much. We used fuzzy cognitive maps a lot, and mainly thanks to its flexibility and applicability across diverse populations. In the recent years, it has become increasingly popular in participatory research, although it's not in its origins, it was not developed as a participatory method, but it was mostly from the field of engineer and computer sciences. Okay, good. So this technique is not a new method, and it's rooted in a very long-standing tradition of using graphs to solve mathematical problems. It merges the principles of graph theory with the more recent advancements in fuzzy logic in computer science. So we have documented multiple examples of how to use fuzzy cognitive mapping for participatory research in many different contexts. And one of its advantages is its ability to provide a visual interface for interacting with complex data. So the maps can simplify very complex matrices used in computational procedures into graphs or statements that are easy to understand basically for everyone. And so the maps, in fact, because of that, are visual methods to represent cause and effect relationships. And they are very variable. They are very they're very good tools for understanding the transformation, because achieving change requires a clear theory of what will drive the desired transformation. So fuzzy cognitive maps help us to build and visualize these theories of change. The maps are basically graphs showing causes linked with their outcomes or consequences through arrows, and the arrows are weighted to indicate the strength of the influence. When we work with community members, they usually express their views on the strength of their relationships with numbers between 1 and 5. So weight of 5 will indicate that if the cause occurs, we will almost certainly see the outcome. A weight of 1 implies that even if the cause occurs, the outcome might not. And so the maps are very useful tools, because we can identify what to measure in terms of the changes that we want to see. So this visual nature of the method makes it easier for participants to share what they know. And this, for example, is a community map from Nigeria. And when we discuss the relationships one at a time, during the mapping sessions, participants can describe very complex knowledge of all the things that they think may affect the occurrence of an outcome based on their experience of the issue. The maps can help us understand what truly matters to community participants, and then adjust the measurement tools to respond to this. We can measure changes in the main outcome of the map. Let's say we were discussing experiences during the COVID-19 pandemic, or we could also identify other factors that could drive a lot of change in the desired outcome as part of an indirect paths, and measure these changes as a result of an intervention. The visual nature of these maps has the potential to transform the research process itself. The maps offer a formal way to understand this transformation by comparing the different views that are contributing to framing our theory of change, and by facilitating the discussion around these perspectives. So, for example, in Nigeria, the maps were very useful to communicate results with many community members who don't know how to write or read. And this enabled them to share their ideas on what actions to take based on the data, on the actual data that was on the maps. So the work of our colleagues in Bauchi, in northern Nigeria, is a very good example of how the maps can contribute to incorporating the voices of communities in identifying what are the changes that matter the most to them. In this region, the impact of the COVID-19 pandemic was not so much on the number of deaths due to the virus infection, but more the indirect consequences associated with the complicated situation of the pandemic. So the team in Bauchi conducted 96 mapping sessions with 324 participants to discuss what made their experiences worse during the COVID-19 pandemic. These sessions included people from urban, rural, and remote areas, as well as municipal and state authorities. The maps even allowed the participation of groups of people with disability to voice their specific concerns and views of what happened during the pandemic. Making the maps did not require complicated technology, but the field team went over a very detailed training process and piloting of the procedures to guarantee good quality data in the study. So the Bauchi team used freeware to digitize the maps, enabling computerized analysis. And across all the maps and all the groups, participants identified 152 unique factors linked through thousands of relationships. So the field team grouped these factors into 25 thematic categories to facilitate the communication and discussion of the results. When we consider the results from the 96 maps, the 5 strongest categories were hunger and lack of food, lockdown and movement restrictions, reduced business and jobs, an increase in household conflicts, and stress and mental health issues. These concerns were shared by the different groups of participants with some minor differences. But here, for example, the position in the rank of the importance of different categories of factors is pretty much the same for male and female perspectives. The concerns were also similar when we looked at rural, urban, or remote communities and other subgroups of participants. So communities showed that the most problematic aspect of the pandemic had to do with increased difficulties in getting enough food and with a reduction in economic activities that in turn contributed to more food insecurity. All these impacts had lockdown and movement restrictions as their leading causes. Now, this is rather different from what emerged from a scoping review of the literature. When we looked at all the studies in rural Nigeria, we found 33 studies that address what the issues that happen in addition to death and disease linked with COVID-19 infections. All these studies focused on what researchers consider to be important concerns to evaluate, basically based on what those researchers knew about the issue. And there were some important differences when we compare the categories mentioned by communities with the literature. So the literature emphasized the issues surrounding access to health services, communication, or misconceptions about COVID, including fear of vaccination and things like that, which were rated very low in the stakeholder maps or not mentioned at all. And although the literature and community maps shared their concerns about hunger and the role of lockdown, they had rather different perspectives on the main issues affecting rural communities in Nigeria. So based on the maps, the research team then adjusted the measurement instruments to inquire about hunger and household conflicts in the baseline survey. So things that rated very high in the maps. And then the findings from the maps and the baseline survey were the basis for a dialogue and discussion with community groups about what to do next. And then these community groups participated in developing the storylines for 2 evidence-based docudramas that they share across communities. And if you want to know more about the process of developing the docudramas, probably Umaira can answer some questions in the Q&A about this very interesting process and this very interesting participatory visual method. So the docudramas and discussing the information in the docudramas that was basically about the impact of the pandemic and in the communities and the households and points towards some potential solutions was key to bring all this evidence broadly across participating communities. These discussions of the docudramas motivated the communities to take action, basically. And some groups decided to work together to produce more food or organize themselves in associations to support each other in their economic recovery. And even local authorities engaged in this process to adjust their programs to respond to the priorities identified and discussed in the docudramas. So I really thank the team in Bauchi for this very, very interesting work that shows how participatory visual methods were very powerful in identifying priorities to action through socio-cognitive mapping and discussing solutions through participatory docudramas. So now I'll pass the microphone to Dr. Anne, who will share another, I think, exciting example of the impact of participatory methods in Nigeria. So thanks.
Okay, thank you very much. Yeah, good afternoon, good morning, everybody. Please take a couple of minutes to do a little stretch. I'm aware that we've been talking at you for a little while, so I know that's difficult. So my piece in this webinar is about the quantitative measurement of impact of participatory visual methods. I'm going to talk about why we need to do it, some of the issues about doing it in practice, and how it fits in with other methods of measuring impact, like using narratives. It's not about using either quantitative measurement or qualitative measurement. The strongest approach really is by using a mixed methods approach. So start with some general reflections about quantitative measurement, particularly as they apply to measuring the impact of PVM. And then I'm going to describe our recent experience with measuring the impact of adolescents creating and sharing cell films in Bauchi. Umaira's description about narratives of change is from the same project. So yes, the first question is, and it's something that quite often comes up, is, well, why do we need to do quantitative measurement? As Neil mentioned at the beginning, everybody who's used PVM knows that they can have a profound impact on participants. Many of you will have experienced this. Our team are relative newbies with cell filming and other participatory visual methods, although we have a lot of experience with participatory research in general and with quantitative measurement. So let me ask again, why, when we know that these methods have impact on the creators, why do we need to use quantitative measures to measure the impact? Well, I would argue that it's precisely because we know that they work, these methods work, that we have a responsibility to prove or to demonstrate that they work. And yes, using hard numbers and statistical tests. Because numbers talk. Funders often need quantitative evidence of impact to put their money into a project. And decision makers, for sure, if they're going to need to fund a rollout, they need to be convinced in terms they can relate to. So Neil mentioned the scoping review carried out by Yasmin Elmi about the impact of participatory visual methods among adolescents in sub-Saharan Africa. And briefly, only 3 of the 9 included studies measured impact on participants, and there was only one, which was the same study, in fact, that had a comparison group that used quantitative measures and that defined potential impacts in advance. And that was the study about participatory video that Mona undertook in Ghana. Mostly the impacts emerged informally, and in all cases, there was just one measurement of impact. There were no longitudinal measures. So these are the conclusions from the scoping review. I've cheated a bit and expanded on them. For quantitative measurement, we need counterfactual comparisons and a bigger scale than typical for studies of participatory visual methods. We also need to measure time course and duration of impacts. So I'm going to talk a little bit about these requirements and then describe our work in Bauchi. I'm going to go over these quite quickly because Neil has already alluded to them and I don't want to spend too much time. The counterfactual, basically it's compared with what? One approach is to compare outcomes between people who engaged in PVM with those in people who didn't. There are a lot of issues with doing this sort of comparison. I'll just mention some relevant ones briefly. It matters because if you're going to do a quantitative measurement of impact, you have to think about it in advance and you have to design the study in advance so that you can make these sorts of comparisons. It's usually too late to think about these things once you've come to the point of analysing the findings. So the first thing that sort of the groups, the comparison group needs to be similar to the treatment group or the intervention group with respect to factors that may make a difference to the outcome. So for PVM, you can imagine this may, say you're looking at self-esteem or communication skills as an outcome, then things like age, gender, education, economic status, and so on may make a difference. So at the very least, you need to know about this in the different groups so that you can take it into account. Just to mention that people or groups who volunteer to participate in an intervention, say making cell films or some other participatory visual method, they're likely to be different from people who don't come forward or who actively decline to participate. And they're likely to be different in ways related to the outcomes. This is just an example from an article submitted to a journal. Of course, students in the schools interested in the education model probably already had more knowledge than students in the schools not interested. So it's very hard to interpret the finding of more knowledge in the schools, the volunteer schools, as evidence that the new module worked. Randomized controlled trials have a bad reputation as being researcher-led and impose interventions and pay no attention at all to the needs of the participants, even keeping them in the dark as to what treatment they're receiving. But it doesn't need to be like that. Community-led trials do things differently. We don't have the problem of saying, oh, well, it's not fair to not give the intervention for people who might need it. You can randomize the delay so that the initial control group eventually do receive the intervention. The treatment, typically when we're doing our participatory research, the intervention is sharing and discussing evidence, and this might involve using PVM for that. And the actions are decided by the communities. So the actual meaning of the word treatment, it becomes different. And Iván has just mentioned that participants themselves define the impacts to be measured. There is this issue about, well, the effect of doing anything, and certainly in the work in Botswana with older people, they're very happy that somebody is taking an interest in them, and they've expressed this to us. Now, the question is, if we just took an interest in them without doing anything else, without doing any sort of specific intervention, would this be just as effective? So this leads to questions about, well, what should happen in the control participants while the intervention is going on in the intervention group? Should they have some sort of meetings, but without the particular activities? There's no right or wrong answer to this, but I would say that taking an interest may itself be part of the dynamics of the intervention having an effect. There are pros and cons of allocating people individually or as groups. With individual allocation, you can allocate so that the groups are matched for important characteristics. It allows for individual follow-up, which might be important for looking at time trends. Major concern is this thing of contamination, the idea being that people who are in an intervention about improving knowledge, for example, may share their improved knowledge with people who were not in the intervention group. And so you would underestimate the effect of the intervention. In most of our participatory research, we allocate not as individuals, but as whole communities or groups of communities. Major advantage is that it not only recognizes, but values the socialization of impact, so that the impact is not just among individuals directly involved in the intervention. We actually want this contamination. We want to be able to see the effect of the socialization. Community actions are often the main reason for the impact impact we're measuring. So the follow-up is at group level. We want to see at the overall, the communities that had the intervention versus communities that didn't, but we can also embed individual follow-up. Often, it may not be possible for lots of reasons, it may not be possible to have comparison, different group of people as a comparison. So one approach to that is to say, okay, the counterfactual is comparing individuals with themselves before and after. It's a weaker design for attributing causality, particularly if there's quite a long time lag between intervention and the follow-up, because there may be many other things that happen to people during that time, and perhaps those are the real reason for any changes. It allows for a paired analysis across time, can be very powerful, and I'll mention that. And we can also do longitudinal studies of people followed up over time. Neil has mentioned the advantages of scale already. I'll just say that, yes, if you're measuring quantitatively, you're going to be looking at statistical significance, and that's mostly related to study size. If you want to do subgroup analyses, you need a big enough number to be able to split up into smaller groups to compare the effect in different groups. The other, I think, underestimated advantage of doing bigger studies in the first place is that it demonstrates the feasibility of scale-up if the intervention is effective. It's all very well that, yes, this intervention works really well in a small group. What would it take to do it at bigger scale, which is what you're going to need if it's an effective intervention and you want to scale up? So that brings me then to talking about what we did in Bauchi, Nigeria. We called it cell filming at scale. Our first challenge is what would it take to do this cell filming at scale, given that most of the reported experience with participatory visual methods, including cell filming, is relatively small scale. We contributed a chapter to one of Claudia's books about this. So we were really delighted to be asked as newbies to contribute a chapter. So first, with the help of the Participatory Cultures Lab at McGill, we trained our senior core team to make cell films. They went on to train a junior team of young people in their early 20s to make cell films. And we held our own cell film festival in Bauchi. This encouraged the team and it drew government partners into the process. So then in the communities, the junior team ran 2-day workshops for adolescents and trained them how to make cell films, including the storyboarding and the filming of their cell films. And then the adolescents screened these cell films to the community leaders and their parents. And then the adolescents themselves and the adults prioritize the ASRH issues for their communities based on what they'd seen in the cell films. What were the numbers? 30, I think Umaira mentioned these briefly already. There were 30 intervention communities, 4 groups in each community, so 120 cell films, and then 540 participants who made the participating adolescents making cell films. So quite good numbers. Making the quantitative measurement, we did this at 3 points. First, at the beginning of the cell film workshop. Second, immediately after screening the cell films, which was 2 to 4 weeks after creating the cell films. And then a second post measurement was 3 to 4 months later. So beginning of the workshop, post 1, immediately after the cell film screening, and post 2, 3 to 6 months later. And the questionnaires, were electronic questionnaires, and we used a technique of facilitated self-administered questionnaires, where the facilitator stands at the front reading out the questions. The youngsters enter their responses on their handsets, and we have other facilitators checking in case anybody runs into difficulties. But we found it works quite well. So the instrument we used was informed by the participant perspectives, as discussed by Iván earlier, and we used a combination of validated standard instruments and some study-specific elements. So we used the Rosenberg self-esteem scale. It's a widely used 10-item scale, scored 0 to 3 with a total score of ranging from 0 to 30. Then we had a short version of the self-efficacy scale with 6 items, again scored 1 to 5 and an overall score of 6 to 30. We also used some modified health literacy questions. I'm not going to talk more about those in this presentation because we're still analysing those. But we also then had a section specific to this study about communication. And this asked about communication abilities using the different steps in the Cascada, this Cascada model that Neil had referred to earlier. And this gave us a scale with a range of 12 to 60. Now, wait for it. We encouraged some issues with the self-efficacy scale and the Rosenberg scale. First, we had to find scales that were applicable for youngsters as young as 10 years old. And we decided in the end that the Rosenberg and the 6-item self-efficacy scales were okay for that. There are no available Hauser translations. There were no available Hauser translations. The translation became difficult. When you look into this, these are very idiomatic phrases in English. And the Rosenberg had some particularly challenging things. I've put here on the slide one item, and what we came up with the back translation of the Hauser translation. It basically changed it from a negative statement to a positive statement. We had to kind of reword the English in order to get a proper translation. So translation was an issue. Now, what did we find? We got very excited by these findings. Amar on our team, I think he's here today, he deals with our quantitative data sets. He was sitting with me in a room in Bauchi when I completed the analysis and saw the findings. He was surprised to see me jumping up and down and waving my arms around. So I'm just going to summarize what we found for self-esteem based on the Rosenberg scale. Just to remind you, PRE is the questionnaire on the first day of the cell film training. Post 1 is after they screened their cell films, and post 2 is 4 or 5 months later. To test for statistical significance, we used a paired t-test, comparing individuals with themselves over the 2 time points. Now, there was a modest increase in self-esteem between pre and post 1. it was statistically significant, but not very big. There was a bigger increase, however, in self-esteem score between post 1 and post 2, 4 to 5 months later. So it wasn't just that this effect persisted, it increased. Here's the same analysis, this time for self-efficacy. Again, a very modest increase, although statistically significant, between pre and post 1, but a much bigger increase between post 1 and post 2 several months later. And now this is the finding about the communication, confidence, and skills score. Very little increase really between pre and post 1, but a much bigger increase between post 1 and post 2 some months later. So we believe this is the first quantitative confirmation of participatory visual media impact on participants, and it fits with what the MSc stories told us. But here's the big news. The changes between post 1 and post 2 were not brought about or led by us as the researchers. We'd left the scene by then, really. What was happening in the communities after the adolescents screened their cell films? Well, in each community, groups of adolescents and adults prioritized the issues of concern, and they set up dialogue groups to plan and implement actions to tackle these concerns. The top 3 issues were pretty much the same across the board amongst all the communities. Communication between adolescents and their parents tended to be number 1. Adolescent drug use and violence in the community, inside and outside homes, came up as the next 2 important issues. Now, the local team did keep in touch with the dialogue groups, and they visited them every month or so to see what they were doing and to help them overcome any obstacles. But communities were the ones deciding and implementing actions. And the dialogue groups, as you can see here, they included adolescents and women as active members. The interesting thing is that the numbers in the dialogue groups haven't gone down over time, they've been increasing. So this study is ongoing. We plan to do another measurement amongst the cell film as a post-3 questionnaire, if you like, nearly a year after the post-2. We haven't done it yet, but we plan to. And we'll also be carrying out a repeat of the baseline household survey of adolescents and their parents in all 60 communities. We hope that this will show overall differences between communities. So even among those who didn't directly get involved in the cell filming and dialogue groups, showing the multiplier and ripple effects. So that's the big news. One other exciting outcome of this work in Bauchi is that it inspired work closer to home in Montreal. I'm going to hand back briefly to Iván now, and he's going to briefly talk about measuring the impact of making fuzzy cognitive maps on teenage participants in a study in Montreal. It used the same instruments as we used in Bauchi, largely. So over to you, Iván.
So I'm very happy to share how the learnings from Nigeria have informed our work here in Montreal. And in this case study, we looked at the impact of participating in fuzzy cognitive mapping session. Of course, is a participatory visual method on the actual participants, on the authors of the map. And so the overall study in which we use the maps was looking at how mental and physical health services offered by a local clinic for teenagers could be made more accessible to them and best meet their perceived needs. So we basically worked with a group of 27 adolescents, all of them between 15 and 16, and in their last years of high school. With these 27 adolescents, we facilitated the creation of 11 maps. And during the mapping sessions in the schools, our team worked with groups of 2 to 4 participants to create a map. And each of these sessions was led by a trained facilitator and accompanied or supported by a note taker who was basically recording the discussion and the first mentioned by the participants. So to start the session, we obtain informed consent, and then the facilitator asks participants what they believe will promote or impede or hinder their access to the clinic. And so the responses were recorded on magnetic tiles and placed on a whiteboard with basically trying to arrange those with similar or close meanings, with similar meanings close to each other. And then once the relevant factors were identified, the facilitator asked participants to share their views on the links between the factors, and then help them draw the arrows to connect the concepts on the maps. And then when no new or no additional arrows emerged, the facilitator asked participants to weight each connection from 1 to 5 to indicate the perceived strength of each influence. Once the map was done, the group basically checked the map, made any necessary adjustments or corrections, and that was basically the session. So during the sessions, we saw all these aha moments that we have seen before in many other mapping sessions. It is very common to hear informal reports from the mapping sessions describing how participants felt encouraged when they saw they had created a complex model composed of many variables and interacting relationships, showing their understanding of the topic. They often express pride in being able to contribute to better understanding the issue. But this time, we used the three scales that Dr. Cockcroft mentioned in her presentation to compare if there were any changes after the mapping sessions. So the adolescents completed pre and post mapping, pre and post questionnaires right before starting the mapping session and right after finishing it. And so the first scale looked at confidence of the teenagers to communicate with others. And it used 6 statements with 5 possible responses from strongly disagree to strongly agree, weighted between 1 and 5. So I'll give you a moment to look at the statements so you have an idea of what the scale is about. And so those with more confidence in their communication capabilities rated closer to 30, the maximum score that they could get. The comparison before and after for each participant showed significant improvements after the mapping sessions for most of them. And you can see that the average scale for the group increased. And the results from the paired t-test made us confident that these differences did not occur just by chance, right? Now, the second scale measured self-efficacy. This is the confidence of participants in their ability to achieve a goal or a task. And so you can see here the 6 statements included in the scale. And this scale also used responses weighted between 1 and 5 for a maximum of 30 points, same as the previous one. And so we also found significant positive improvements when we compared the responses before and after the session. And finally, we used the well-known Rosenberg scale, which is based on 10 questions, as we already said, with responses weighted between 0 and 3. And the maximum value of the scale will be 30, which will indicate the highest level of self-esteem. So although the improvement was small, the significance test also suggests 95% confidence that these differences were not due to chance only. These changes were identified right after the session. So the only thing that changed for the respondents was their experience during the session. However, we cannot know if these changes remained after some weeks or whether it was just the excitement of the moment. But we consider it very encouraging to have an initial measurement to support this anecdotal accounts that we had seen in many mapping sessions, showing us how people feel very, I will say, empowered or excited of using these methods to share what they know. So thank you for being here, and I will pass it on to Dr. Andersson to continue the discussion.
Thanks very much, Iván. So we have two commentators. They're not from the general audience. They're not general people at all. There's Claudia Mitchell, who is general of another kind, is one of the most influential people in participatory visual methods worldwide, to share her comments on it. She certainly influenced us into this, and so I guess kind of a chance for her to comment on the work that she's caused to happen. After which we'll have Megan Légaré, who is an emerging Indigenous researcher, describing her work with these methods in relation to Indigenous cultures. So Claudia, welcome, and thanks for coming up.
Oh, thank you very much. I'm just about falling off my chair here and imagining this recording has got to go viral. This is like the best, most influential piece of work that we're going to see, or the start of, in terms of thinking through the impact work, the impact of this work. And I'm so excited by all of the presentations. And I loved your point, Neil, at the beginning. Small is beautiful, but scale is amazing. And like trying to think through the responsibility of showing and making the evidence so clear to policymakers and everyone else, starting with the participants themselves. So I'm very excited about this. And maybe just to say to everyone in the audience that Neil and Anne and members of the team are also part of a new project that I'm working with called Transform, engaging with young people for social change, looking at gender transformation across 6 countries or more. And really in that project, we have 3 main nodes or axes. One is really these gender transformative interventions in the various countries, Nigeria being one of them, South Africa, India, Argentina, Sierra Leone, and Mexico. But then we also have a whole group of people who are looking at how to work with young people to set up global dialogues and to study what does it mean for young people to have a place at the table. But the third node, and the one that is really the centerpiece for this work today, is on studying impact and thinking of how to bring together people like Neil and Anne, April Mandrona, Shannon Walsh, many others, to think about how do we study this? How do we learn across sites? How do we learn across countries? How do we learn across generations? And I think the examples that we heard today here are just absolutely exciting. I've been hearing so many pieces, obviously, about the cell filming and the Bauchi Cell Film Festival being the first cell film festival in Africa. So there's all sorts of impact pieces there that are first, but really coming to really take such an intentional, detailed, and massive approach to thinking about how we understand change. So really, this is groundbreaking, and I'm glad there are so many people here to see these presentations today, and I know that they're going to also be distributed widely. Some of the work that that we've been thinking about, or that I've been working on over a number of years, is, I think, really picks up on the idea of using participatory visual methodologies to study participatory visual methodologies. So I love the way that came up over and over again. Now you have me like thinking, okay, we did a lot of work in South Africa in university settings where young women were trying to address gender-based violence, and they were making cell films, they were doing photo voice, they were doing concept mapping, and they were having meetings with policymakers on campus to see how change could happen. And one of the things that we tried there that I think was very effective was to have the young women invite them with their cameras to go around campus a year later to find out what could you see that was visibly different. So it ranged from signs put up in the residences saying guests have to leave at a certain point, lights installed in places that had been dark, training sessions. Not everything changed, but that idea of actually being able to use the methodology itself to go around and track change, I think, was very important. Something else that I would be interested thinking about in terms of scale is tracking policy change. Again, I'm going to use a South African example where in a rural community called Loskop, young women made cell films about forced and early marriage. And they were so powerful, and they led to community dialogue with the girls screening their videos. But what it really also led to was key members of the community, including the chief and other elders, going to the legislature in Pietermaritzburg and saying, we need to be able to do something in our community. We need to have some protocols in place. And this dates back to exactly 5 years ago. I think exactly at the moment when the policy was to go to the legislature was, I think, the first day of COVID. And so everything got slowed down, but really trying to think through how do policies change, and how can some of the work here really influence policy change. The last piece I wanted to mention, because I want to get on hearing Megan's work and hear all the questions. But the last piece is to maybe think about the reflective pieces. And we've in a project called Pathways to Equity and More Than Words, 2 projects I've been directing with Indigenous youth in Canada, we've put together a couple of documents, one called Studying Change, which I think Iván is going to put in the chat, and another one called The Trail of Promising Practices in Youth-Led Work. And in both of these, we've tried to think through, I guess, the small is beautiful piece of it. Now we have to redo these as scale, but trying to think through ways of doing this kind of evidence collection without being too intrusive, and making it something that people would want to do anyway. So being at exhibitions and commenting on bringing out stories. So it's not something added on, but it's something as part of, which I think can be a very powerful piece. And maybe just to say, thinking through the reflective pieces of the questions I think that come up in small pieces that maybe we could expand on in new types of questionnaires and reflective pieces, is to add questions like, what does it mean as an older person to play a younger person? We had young women in Mozambique commenting on, they were making cell films about gender-based violence, and they said it was so strange to play the perpetrator. And not that we were seeking empathy for the perpetrator, but thinking through what mental process do you go through to be the other person, or to be the teacher who is inflicting corporal punishment, what these pieces that kind of help us think differently about what our own positionality, but also what does it mean to bring about change. So I'm going to stop right there. I really do think this is a viral piece. It's going to be required viewing for every single student that I'm working with, because I know they're going to love it. And maybe to say a shout out to Pamela Lamb, who I think is in the audience somewhere, for her work, which really has been around audience and impact, and thinking through affect, and how do we study affect, and how do we make affect a bigger piece in here. So congratulations, amazing. Big,
Thanks,
amazing,
Claudia.
big, amazing. Thank you.
Thanks, Claudia. Megan, you need to unmute.
Yep, I was waiting on Andreas. Okay, so hi everyone. I'm Megan. I'm Ganyangehaga, so it's an Indigenous community close to Montreal. Because I know we have people from all over, so I just wanted to precise that. So my work basically revolves around working with Indigenous youth on cultural continuity. And so during my master's, that was my focus, and especially because I mean, that's across like countries and communities and everything, but youth voices are often kind of discredited or not heard. And with Indigenous youth, it's kind of even worse in Canada, where they're really not really listened to, and that's sometimes in their community, at the government level, and sometimes policies and programs or anything else is really done without their input. And so a lot of the feedback I've had over the years was, they do these things for us without even asking what we want. And how does that work? Like, then we have things and youth don't engage. And then they're like, why are youth not engaging? Well, because their input wasn't there. And so, especially with cultural continuity, usually in many Indigenous cultures in Canada, it is the elder that kind of has that role. And there's a lot of pushback on if youth should be the ones kind of carrying that torch, because usually it's the elders. And so I really focused on that. Like, what are the visions for youth about passing down the culture? What do they see for the future? Is it more modernized? Is it that they want to roll in it? Like, how are they doing that work actively? And so I really spent a lot of time with them, a year of just learning and getting to know them and kind of hearing their stories and building that research with what they like and what they would like to talk about in mind, and really grounding the culture. Because as I mentioned, like, cultural continuity is a very important issue to Indigenous youth in Canada. And so, yeah, and once we did that, we did a whole sharing circle, and I really centered their voices in even the final piece. And I would say the impact it had was that in the space, like, really grounding it in culture and listening to their needs for that year, and really grounding it in what they wanted, that consultation piece, giving them a seat at the table with me in that building of research, really empowered them and really made them more safe and secure into being vulnerable. And all these youth kind of know each other too, so that was really easy for me to navigate that space and really have a bonding moment as well over our shared struggles or shared ideas over what we want. And even when I kind of sent them the piece and was just asking for what they thought about it, it was really interesting how some of them would see a quote and I would point, oh, like, you said that. And they're like, I said that? I was like, yeah, you did. And they were like so proud of themselves. I didn't know I could speak like that. I was like, well, I did clear up your like and your but like, it is what you said, you know, like, you said that. And they were really proud of what was said. Or I used photo voice as well to capture culture and what that means to them. And even seeing the work of the other youth in the piece, they were really impressed with the others as well. They were like, wow, like, I didn't expect the pictures to turn out that way, or I didn't expect people to say these things. Like, they're really empowered by their own words and each other's words and each other's like commitment to making this piece work. And so it's not as fancy as like all these numbers, but I think it's really important to do have that feedback in the way of youth on that one-on-one level too, of knowing that you've made a small change maybe in their lives, or maybe like, you know, that you've given them that power that they didn't know they had, even though it was within themselves, like, really bring that strength back. And yeah, even after, sometimes I would get feedback on like, how did you like the sharing circle, things like that, and they're like, that was really nice, that was like my favorite activity of the week, or things like that. And they were like, I really enjoyed sharing with other well-minded like youth, and it was really interesting to do these things. So I think that's one of the strengths of participatory research, action research, is really that ability to have that one-on-one with participants and making sure that you're also with them along the way, and making sure that you're they don't feel, not as, I don't want to say lab rats, but they don't feel like they're just a piece in this puzzle. Like they're really a part of it. They're making it with you. And I think that's one thing I enjoy working with Indigenous youth, is that aspect of, we have so much to say, and it's really nice to be able to provide space for that and uplift and empower their voices when they feel like they might not have one. And that's my work mainly.
Great. Thanks very much, Megan. So thank you all very much. We do have a good half hour for comments and questions and shared experience of your own efforts in measuring the impact of participatory visual methods. Andres, did we have anybody that I missed in the Q&A? My Q&A says no open questions.
Yes, you're right now. No open questions so far.
Okay, so people can just say them themselves.
Can people raise their hands to ask a question as well? Is that also possible?
Yeah,
I guess you'd have to unmute them.
Yeah, that's the only way I would know. So yeah, if you... Oh, there's Mona.
Mona. Okay, give me a second.
And Jenny Wang. So Ramona and then Jenny Wang.
Thank you so much. Thank you so much for the presentations. It was really beautiful to see such a wide range of initiatives. I was wondering if there's any research or some insights around the concept of like shifting power dynamics. I think as participatory research efforts, especially these participatory visual methodologies, are taking place, and individuals are gaining agency, learning how to communicate skills, there's naturally some shifts in power dynamics. I'd really love to hear more about your experiences, your thoughts, and how you navigate those things and encourage them.
I think the summary answer is that we need to do better, but it could be that Umaira has some examples of those shifting power dynamics in most significant change. What we haven't done is, I'm pretty sure we haven't done any quantitative measure of shifting power dynamics. Sense of empowerment, sense of agency, those things we can show. Umaira, would you like to comment?
Yes, thank you, Mona. Excellent question. We have a lot of shifting power dynamics across stories, and not just in the stories of adolescents, but also adults. I shared some examples in my presentation that, for instance, parents have started regarding adolescents as almost their equal. And some of them told us that their culture didn't allow it. They were not raised to think like that. But after watching the cell-films that adolescents made, it made them see things differently. Now, this is something that is coming out, not just parents saying that about their children, but married girls also talked about how their husbands have started looking at them differently, that communication has increased because they are now communicating more with their husbands, and husbands have started communicating with their wives. So that is also changing things for young married girls in their families. Then the community leadership, I cited 2 examples. They have also started looking at things differently. So a lot of that in a lot of stories, all very good, all very, very promising. And it's amazing to see how just, a creation of self-film can lead to so many things at the level of the community, making a self-film, which then led into communities making dialogue groups. And then so everybody becomes involved, and we are witnessing things changing. Like one pastor said that, it was the African method, you can just slap children, but not any longer, because now they are talking to them, now they're listening to them. So it's very exciting, very promising. Thank you.
Great, thanks, Umaira. Jenny, and then we have a comment from, I think from
Hi,
Jean.
Hi, can you hear me okay?
Yeah, we hear you fine.
Right. Thank you. So I actually had a question about some of the surveys and everything that was used. I think it was Dr. Anne Cockcroft who was presenting when they were talking about some of the surveys and how they were decided amongst the participants themselves, how the effects would be evaluated. Given that I think the study was conducted, abroad, I was wondering what was the process like when you were translating, some of the survey items and the questions to suit the context and to actually maintain that same meaning. I know there's kind of a lot of debate sometimes within the area about translation of these surveys and the validation therein. So I was wondering if you could speak a little bit more to that.
Shall I respond to that?
Please do.
Yeah. Yes, thank you. It's a huge issue. And just translating the words doesn't cut it, because, this whole idea that, okay, we want to do, we use standardized modules in the DHS and so on. Yes, you're asking the same question, but that question means a different thing to people in different cultures. It has completely different connotations. So I think there's the whole issue about sort of standardized instruments and the comparison between places is largely kind of a myth that you can make those comparisons. And for me, it's more important to be measuring things that are relevant locally. So what is important to the people there may not be important somewhere in a different place. Okay, maybe you can't export it, but you can export the method of doing it, so that you ask about things that matter to that outcome in that place. And that's where things like FCM and so on come into play. Then the actual language stuff. I gave one example, the Rosenberg scale, for example. It is so idiomatic when you read it. You realize that, unless you're a native English speaker, this means something quite different. So we spent ages trying to get the translation right. And to me, it's really important to do that. So yeah, thank you for raising that. It's a huge issue and it takes a lot of work, but it's worth doing that work to make sure that you're asking about things that are amenable to change and that people locally think are worth changing. So yeah, just a brief answer to your question.
Just a quick note from Jeannie Haggerty, who wanted to remind us that it's another impact or another layer of impact to reflect back to the participants what was learned, in a sense, closing the cycle by sharing with them and consolidating whatever experience they've been through. The sharing, I think this is a point that Megan made as well, that the feedback process with the participants lands up having its own effect. That's worth having. So we had a comment from Azam and then Shamila.
Hi, thank you for this amazing presentations. And I am interested in the potential visual data and in translating experiences into action-oriented. So I specifically have the question for Dr. Anne Cockcroft. So my question is that in what ways can data visualization help bridge the gap between policymaker and community experiences, particularly for marginalized voices? How we can translate this visual data and link them with community experiences?
It's a point that Claudia mentioned. Do you want to try to have a first go at that, Claudia? I know we're all concerned about where it goes after the local setting, but Claudia's actually been formal about making that an initiative.
Yeah, I think I think you have to plan for it, and it's very interesting in the Lost Cop project that I talked about. I don't think my colleagues ever dreamt that this was going to go to as far as the legislature and come back to the community, but they did see the value of taking it to the community. In the new project of Transform, they're working in a new setting in Shlatakulu. It's a new a new site, and they're already working very closely with the Nkosi. We had a summit, a youth summit in South Africa last week, and actually the Nkosi from Shlatakulu did the opening talk at the session at the summit for all these young people. But already my colleagues from UKZN have had several meetings with him to try to think through what are going to be some of the policy implications of this work, and bringing him in and the council in from the very beginning, because that is, I think it's something that they've learned along the way, or we've learned along the way. Some time ago, Lebo, my colleague, went to another site, and they said, yes, you can come in and do this research, but just don't change anything. Which is, of course, not what we want. And I think what we're learning and what they're learning is bringing people in a very consultative way right across the board. So and I think it also picks up on the idea of youth and elders, that maybe older community members are not used to listening to youth, but the team itself can be part of almost a mediating feature in there to make sure that this happens from the very beginning. I don't know if I've answered your question very well, but that's what I was thinking about it.
Can I add something? Which is to say that, for instance, in the work in COVID, the COVID project we mentioned, the government body that is responsible was responsible and is still responsible for getting sort of support out to communities to help them with COVID recovery. They were actually part of the process. They helped in designing the instrument that we used for the survey and so on. And they came with us to the communities for the surveys. So when we were then kind of feeding back to these government bodies about the fact that, like, almost none of the households, like it was like 3 out of 1,000 or something, had received any government support during the process that they were supposed to receive. But he was then saying, yes, and I know that's true because I was with them when they went to the households and they asked them. So I think involving them so that it doesn't feel like this is outsiders coming and saying, you know, this is what's what. The people concerned and the people who need to kind of take action on it, not only in communities, but maybe outside, get them on board from the beginning. So they experience some ownership of this. So yeah, I would say getting them on board early on really helps.
Great. Shamila? There we go.
Okay. Thank you, Neil. And it is just wonderful to see and listen to all of you. Dr. Mitchell, I share your enthusiasm and excitement. And also as a former CHS staff, I think it's just really impressive, the advancement on the work embracing technology. And Umaira, just your whole discussion on power dynamics was absolutely wonderful. My question to you, and I think is because I think Neil and colleagues, I mean, you led this work 20 years ago, you know, when it wasn't, or 30 years ago when it wasn't even popular, is given where the times we're in, things change, break quickly. Small is beautiful, and scale is great, but what about, and I hate the word sustainability, how do you see this? What's your intervention to really 15 years from now, in terms of sort of keeping this momentum, this change in power dynamic?
Yeah. I think there are two parts to the answer that I would make before opening it up and getting comments from the others. The first is that by going to scale fairly early on, going as big as possible, and by incorporating government players in the process, we start trying to find the cracks in the existing system that this kind of work can occupy. There's almost no system in the world that can take on a whole new way of doing things. So really what we're talking about is wedging. We're trying to find out existing systems where there are people who could do this kind of work, who are amenable to training, and then work with them. So a big part of it is hustling, but starting on a small scale, seeing who's working at district level, seeing who's working at national level that can be interested in the district level, and getting that to work to show that it's working. The second thing is the story of old, that people will pay for whatever, a vaccine that doesn't work, and they'll carry on paying for that forever. But what does it take to make the change in the investment so that they're actually paying for people to do something that does work? That's another whole issue, and I think it's an ongoing battle. I don't think we've won that one yet. We're hoping with the dementia work, we're hoping with the gender violence prevention that we'll make a sufficient case with those numbers to be able to get larger scale investment. But that's the battle we're in. Does anyone else on the panel have any part of an answer to this issue? It's an ongoing, we're wrangling it. Claudia, you had a comment?
Yeah, I was actually thinking about this morning before coming to McGill, Shamila, because it's a really good question. And in the times that we live in, where we could have taken abortion rights for granted in some places because we've had them for a long time, and now they're being revoked in places, or thinking of other human rights pieces that you think we won and then we didn't, that you like those kinds of dramatic legislative changes. And of course I'm referring to various places south of the border, but also here in Canada, all over, that I think some of the data that we heard today about agency and self-esteem and confidence and those pieces, I think those are sustainable features. I mean, there's another study, of course, I'm just throwing this out. If you are confident, or your level of self-esteem is higher a month or a year later after being part of a collective that has made these cell films, does this continue? How long does it continue? But I kind of think we can look to some social movements and people who like the feminist movements and so on, that there's a lot that people gain in these collective actions that carry beyond, policy setbacks. And I think a lot of what we're hearing in the brilliant data today is that there are perhaps pieces that you can't kind of guarantee the sustainability of a particular action or a program or a piece of legislature that is supportive of young people, let's say, but the kinds of pieces that we've learned about in terms of agency, self-esteem, and confidence, those are perhaps pieces that we can think even more of, and how are they sustained or self-sustaining in these collective pieces. So I guess I would put it out to us as to study that more. But I think there are things that are out of our control, but these are some things that perhaps are within the control of a project or within a program of some sort. So I don't know. Maybe I'm hopelessly optimistic.
I think we have to be. Iván, you wanted to go next?
Just to mention something we've been working a lot lately, which is intergenerationality. So all this work is basically promoting a conversation or a dialogue between different generations. And so what the younger generations are doing is trying to share the difficulties they had with their parents and bringing those learnings to the next generation that they are raising. So I think that is crucial in terms of sustainability, just because it's making it part of the cycle of learning and improving for the next generations. Just
Megan, you had a comment, and I can't see if your hands up.
Yeah, but after Megan.
Go, Megan.
Yeah, I just wanted to piggyback off of Iván a bit, especially like working with Indigenous youth, relying on the government to change is like not, yeah, they don't trust the government that much to affect change. And so with the work that I did and hope to continue, it's more, I would say like it's more reasonable to maybe think about community change and intergenerational change, like Iván mentioned. And when I did the work, like it was not to change policy or anything, but like I have no doubt these youth are gonna continue what they were doing. So like also Claudia said, like building that confidence and that self-esteem probably has maybe a bigger impact in some communities rather than focusing on policy change, because that policy could be reversed. The money could not come in. Funding with Indigenous communities, sometimes like there's a lot of red tape. So focusing on maybe more community initiatives and capacity building within communities might be a more feasible and a more long-term effect rather than going for policy change.
And you had a comment?
Yeah, what I wanted to say follows on very much from that, which is that, I mean, for example, with in the COVID project, what's been very striking is just how communities have felt, oh, okay, so we don't have enough food. So what can we do? We have land around here. So there's this, and okay, these guys can give us some seeds and we can grow. And we've got some wonderful videos and things. Okay, we're doing our harvests now. And then we give so much of that to the women, and they're going to then start their small enterprises with this little start. There's a lot that communities have strengthened. So without having, of course, policies matter, but they can do so much. Just on a local level, just with a little bit, it's like the blue touch paper and stand well clear. People can actually get on with stuff. There's a lot of strength there, and it's building on that strength. And it's been really very striking, particularly in the COVID project, just how much people are managing to do in terms of for their, not waiting for these handouts from the government because they just aren't coming. So that can help to sort of buffer against these adverse policy things, although of course not completely.
Okay. There's another issue of sustainability that came up in the Q&A listing where somebody showed and didn't sign it, but mentioned the very valid point that sometimes this empowering to speak in the participatory visual methods of one sort or another can expose, for example, if they're working with on the issue of gender violence, would expose the people who are proponents of the story to additional violence if they live in restrictive gender norms that have not been changed by the time the work comes out. I think it's a perfectly valid point, and I certainly don't have an answer to it. I think in those settings, we tend to work with the space that the participants feel is open to them without pushing them into spaces that are not safe. But I don't have a better answer than that. Would anybody on the panel like to comment on that issue?
Umaira might want to say something about that. Do you want to say something, Umaira?
Yes, thank you so much, Professor. The first thing which is important is that we don't push people to act a certain way. So we are not pushing communities to change, and we're not changing gender norms or changing community dynamics. The changes are coming from the communities. All that we do is that perhaps we act as a catalyst. So for our work in Bauchi, we encouraged adolescents to work on their self-films. They chose the contents and they chose to speak about those topics. The topic themselves came from adolescents. They decided to do the community screenings. What happened from that time onwards was happening at the level of the community. So if women, for instance, or if young adolescents, if they found space in which they were able to talk, that space itself was provided by the communities. And so that was a safe space. So if a married girl who was previously not able to discuss anything with her husband, if she found that now she's able to discuss things with her husband, it was because the husband participated in the program, saw what she had to say, accepted, agreed, and was ready to welcome if when she became communicative. So one thing that works very well when we talk about participation is that we are not telling communities what to do. We are not telling them, well, this is what you need to do. This is not what is acceptable. What they think has to be done, they do. And so when we talk about changing gender norms, it's happening from their level. And this in itself creates a space. This is what we have seen in our work. Thank you.
Okay, thank you very much. Anybody want to take a final comment?
Yes, I am interested in talks about that numbers talks. You know, I think Dr. Ann Cockcroft talked, and it really has resonated with me because I think it's a tool to talk with policymakers and they understand numbers. But I want to say what are the variables, for example, for evaluating the confidence? What are the variables for evaluating the agencies? And for example, when I want to talk about digital equality, if I say, for example, many girls and women and people don't have access to internet or mobile, nobody listens to me. But when I say 2.6 billion have never accessed internet or mobile devices, and the majority are girls and women, so people listen to me. So I am interested in the way that quantitative measurements helps qualitative measurements, how they can hand in hand support and talk for sustainable development goals such as digital equality, educational equality, or gender equality. So the question is that what are the variables to measure the level of, for example, competence or agency?
You want to try that, Anne?
Yeah, well, yes. I mean, as I maybe didn't explain it very carefully, but we typically use a combination of standard validated scales and then some questions specific to that particular context and that particular survey. So, but even the standardized instruments need to be brought into to be appropriate for that cultural context and so on. So there are lots of instruments out there. It's just a question of looking at and measuring things like agency and so on. They do it to a greater or lesser extent, and they're more or less appropriate for the particular population that you're looking at. But yeah, I think it's a combination of standard instruments out there with instruments that are focusing on the particular cultural context.
Great, thank you very much. Well, we're sort of on the button of 1 hour, of 2 hours, I mean. So there was one final announcement. It was a slide that I had, but I can't find the slide now. So I was going to ask Claudia to just make the announcement of the next of these seminars. This is one of a series of seminars, and the next one is ready for announcing. Claudia, would you like to?
Sure, absolutely. Thank you for giving. There's a slide somewhere, but we will send it out to people. Oh, but on March the 17th, there's going to be a book celebration of 2 new books that have been published by Transform researchers who are all working on gender transformation. So it'll be same time zone. It'll be Eastern Daylight time by then, 10 to 12. So one of the books is edited by Catherine Vanner, Girls Take Action, and looking at activism networks with girls and young women. And the other one is led by Heather Switzer and Emily Bent and Karishma Desai on girls in global development and taking action. So these are two books that are both part of the Bergan Transdisciplinary Girlhood series, but they will be bringing forth, I think, some really interesting dialogue from the contributors talking about gender transformation, some of which will be, of course, I'm sure, drawing on participatory visual methodologies as well. So you're all welcome to come, and we can circulate, if people need information, we can circulate the registration data. So thank you very much, and see everyone on March 17th.
Am I sharing the slide?
Yes.
Yeah, you do.
It's there.
Yeah.
Thank you.
Yes. Yeah, you can take a picture of the QR code. You'll be all set. But thank you.
The QR code. Good. Well, thank you all very much for attending. We didn't know how this could work out. There were a lot more participants than we anticipated. Thank you all for listening and for joining in. And we'll see you next time.
Great.